Good morning, everybody. I'm joined here with Jenn Huston, integrative nurse practitioner here at Integrative Medical. Wanted to talk about a topic that's probably the most commonly brought up question when somebody says, I don't like my medication or I feel like I'm over medicated. Why do I have to be on that? And so what we're going to talk about a little bit today is, the different reasons why somebody might be over medicated, or ways to know if you are, or even just some thoughts on how to get a better way to not be. So Jenn, tell us just a little bit, how do people end up over medicated so frequently in our country?
Yeah, so usually your provider sees you for 15 minutes at a time. They're getting just a real snapshot version of what's going on. So they check you in the office. For example, I'm going to use high blood pressure for an example. So they come into the office, they have elevated blood pressure, 145, let's say over 95, and the provider says, you know what, this is high blood pressure. We need to really start a medication for you. Typically they're going to see you more than one time with that blood pressure. They're supposed to anyway, and then medicate you. But what's the follow through on that? I mean, all medications have side effects, and they really aren't necessarily making sure if that patient in a year from now even needs that medication. Their whole world could have changed, lifestyle could have changed, and they might not need that anymore. I don't know if anyone's really looking into if they do or don't. When they come back, their blood pressure is fine. The doc's just going to let them on their way because everything looks good from a numbers standpoint.
Sure. So when somebody, there are certain medical, even in the medical arena, like the American Medical Association's blood pressure recommendations, there are very documented realities that over time, certain medications will cause more harm than good if they're forced into a low enough number. So like, what should happen, let's say when you use blood pressure as an example, if somebody changes their lifestyle or loses weight or really gets to the cause, what's supposed to happen with being taken off that medication or lower dose?
Yeah, so when you lose weight, your blood pressure decreases a certain percentage every 5-10 pounds that you lose. Somebody loses 20, 30 pounds, their blood pressure has significantly dropped, and quite possibly into that unmedicated range. But that might not have really been looked at then, as far as, because the blood pressure is normal. So I really think we need to really check that, repeatedly. So say a patient comes in, they've lost 30 pounds from when they were put on the medication, and their blood pressure, say 120s over 70s, great blood pressure. Is that because of the blood pressure medication that they're on, or is that because they've lost all of that weight? So we're going to look at the risk factors and say, maybe we can start coming off of that medication and look at what that looks like for the patient.
And that's another fear that you just brought up, is people going off the medication, them having issues with it. And blood pressure, I believe, is one of those medications that you do need to reduce over time. It's something that your practitioner really should help guide you to do so. Is that correct?
Well, for sure, especially if your lifestyle is changing, right? That's what we want. We want to look at the reason why their blood pressure is high. Overweight, eating, poor diet, even if they're not overweight, all of those things can take into account for increasing that blood pressure.
Sure.
So yeah, we need to start decreasing the amount of medication people are on, and we want to do that safely. Medication, like I said, those side effects are crazy.
So, and you actually brought that up when we were talking about this just a few minutes ago. I said, well, how come so many practitioners leave somebody on a medication? And what you told me, I thought was really interesting. Could you just kind of tell the group a little bit about your thoughts or feelings on that?
Yeah, so I think fear is one of the reasons why people don't want to go off their blood pressure medication. And I think the provider too. We don't want to, as someone that is helping you on your team with your healthcare, we don't want to put you at risk either. High blood pressure, that can lead to heart disease. It can lead to stroke, chronic kidney disease, all these things. So out of fear of not wanting to cause those things, we don't want patients to go off of medication in a high percentage of people. Problem that I don't think we think about is all the side effects that those medications have too. And we really have to, weigh weigh the risk on that. If their blood pressure is low, their lifestyles have changed, we can probably take them off of that blood pressure medication, and quite possibly they're going to feel better because of those side effects they didn't even know that they had from their medication.
Right. And you said, so what are some of the side effects of being on blood pressure medication long term?
Sure. I mean, it can actually cause kidney damage. So high blood pressure can cause kidney damage, and so can your blood pressure medication. It can cause chronic headaches. It can cause a chronic cough, anemia. None of these things, so fatigue, and it can actually cause this orthostatic hypotension to where people can pass out and injure themselves. We know that elderly patients that fall over the age of 70, the reality of them being able to, get back up and do what they did previously to the fall is a lower percentage. All of those are very high risk for.
And blood pressure specifically, something I'm going to say a little bit more passionate about because you've seen it.
Yeah.
Lifestyles change in your family. Do you want to tell that story to everybody?
Yeah. So my dad, he might be watching, but my dad used to weigh over 200 pounds. He's about 150. And he has been on the same blood pressure medication ever since I've been alive, which floors me that nobody has wanted to help him go off of that medication. I think that he would feel a lot better if he was off of that. I don't know that he needs that. His blood pressure is 110s over 70s.
Sure. So ultimately, like everything, it goes back to a philosophy to start. I mean, it's getting to the cause of the problem. And when you take responsibility for your health, you can actually take considerably less medication. And the reality is for people, the healthier you are, the less medication you should need to consume. So that's why an integrative approach is so good. That's why I believe so strongly.
I wanted to put out there too, real quick, we're not going to do this unsafe for these patients. So, if we recommend for you to go off of something, we're going to make sure that it is right for you and it is safe for you.
Yes.
And we're going to, if that means coming into the office more frequently, you're checking your blood pressures at home, for example, we're going to make sure that you're safe.
Absolutely. So for those of you watching here that are interested in being assessed or having your blood pressure looked at, or really if you feel over medicated in any arena, I posted on here, imorockford.com is the website, or you can call the clinic 779-423-2044. And Jenn is going to be posting several times a week now on different health topics to really educate you and inform you on natural options and a more integrative medical approach. Have a blessed day, all.